Access to healthcare is one of the most basic rights of every human being. But here in the Philippines, millions of Filipinos still struggle to acquire proper medical care. Yes, let's say there's been progress over the years, but the reality is there are still big gaps in the system that we must pay attention to. Public hospitals and health centers do their best, but the resources are just not enough. There's a shortage of doctors, nurses, and staff. Equipment is outdated. Medical supplies are lacking, and health facilities are just too few and too far away. For many people in rural areas, just seeing a doctor means traveling for hours. Imagine that being your everyday reality. Even with the implementation of the Universal Healthcare Act, Filipinos still pay a huge amount out of pocket. Medicine and hospital bills can also be so expensive that some people are forced to choose between getting treatment and providing for their family's needs. And then there's also corruption. This might be the most excruciating part. Funds that should go to hospitals, equipment, and health workers' salaries sometimes end up in the wrong hands. The result, fewer services, lower quality of care, and more suffering for ordinary Filipinos. It really makes us wonder, where do our taxes go? But despite all this, I'm still clinging to the idea that there's a hope for us Filipino people. The Universal Healthcare Law is a good step forward. Adding more barangay health stations and training additional health workers can all help prevent these said issues. And most importantly, if leaders, health workers, and communities work together, and if corruption is addressed with real accountability, we can build a healthcare system that truly and rightfully serves all Filipino people. Let us all remember, folks, healthcare is not a privilege. It's a right, and it's a right we should all be fighting for.
Hi, my name is Aaliyah Guevarra. You can call me Kinder. And let's talk about healthcare. Because more often than not, bias always gets in between healthcare and people wanting to get proper treatment. I would like to use myself as an example. A few months ago, I came to a doctor for a cold. But instead of giving me treatment, the doctor referred me to a nutritionist to get me prescribed with weight loss medication because I am considered obese. But let me prove you wrong. Even though I am considered obese, I am very healthy and my blood work proves it. I came to the doctor wanting to be prescribed with proper medication for my ailments, not to be judged by how I look or what shape my body is. And let's also talk about sexism in the healthcare industry. Sexism also being another issue. Women's health concerns are often minimized or brushed off as stress or menopause. Like, are you going through menopause? Are you in your period? Or like maybe sometimes like it's all in your head, like you're overreacting. Maybe it's just your hormones. But more often not, it's not just about hormones or stress. It's about like genuinely being sick, and women always get brushed off because of it. Simply because they are women, they are seen as hormonal. And you know, stuff like this being dismissed or brushed off can seriously be a danger to health because being dismissed can delay treatment, and you know, it can be very, very dangerous. And then here's inequality in general. Like, you know, people in poorer communities, or people who live in like, you know, rural areas, people who are in rural communities have fewer doctors or are much farther from hospitals and have less access to affordable medicine. The ones who need actual help are most often the ones who don't get it. So the people in those communities always often do not get treatment or go to quacks instead. I wouldn't call the people that give them treatment quacks But most often, what happens is that those people give the wrong treatment to the people who are in need of treatment, and it always makes the situation much worse. Healthcare needs to be improved. Sexism, fat phobia, inequality, etc. shouldn't stand between people and the care they deserve. Everyone should have the right for treatment. And I thank you.